I am a clinical navigator. I'm an RN, and I'm here to assist those patients through the cancer process from start to finish, from biopsy all the way to survivorship. I think every day I'm impressed with their courage to come in here and face their treatment, and surprised by it. Favorite part of my job is getting the hugs every day.
I feel like I'm very compassionate. I like to put myself in their position, treat them as I would want to be treated if I was going through a similar diagnosis or situation. And I try to be that support person, whether that means they need someone to give them a hug or they need a punching bag, so to speak. Sometimes, we have to go through the grieving processes with them, and we just have to let them know that we care.
I was actually diagnosed with breast cancer 15 years ago, and I realized that this is what I wanted to do when the job posting came up. And I thought, I'm not going to go through my breast cancer diagnosis in vain. It's going to be for a reason. So I decided then and there that I could take my experience and what I went through and make a difference possibly for someone else. A nurse navigator helps the patients get through the system. They help them get to the right doctor, the right time, navigate resources that they may need, and help it to be not as scary as it possibly could be, help to alleviate some of that fear.
Sometimes it's the most tough people that touch my heart the deepest, and they want the hugs and they want the reassurance, and we provide that. Sometimes we meet with our patients for 2 hours. It depends on what they need. And you just, as a nurse, I think it's just become part of me that I just know what they need, or hopefully know what they need.
I can think of a few specific patients that I've actually given my personal cell phone contact to their family members so that they could ask me questions, because their anxiety level was so high. I wanted them to have me available all the time, so I've done that before. One of my patients that was treated here for colon cancer was also a minister, and he and his wife married my husband and I, so I continue to stay close and have a very close relationship with him and his family.
I learn from my patients every day, actually. Cancer touches all of us. Honestly, there's probably not one person who doesn't have a family member who has gone through cancer. I mean, whether they're young or they're old. But the patients inspire me. They inspire me to do what I do.
What makes us different, I believe, is the level of commitment to each and every patient that we see. It's an immediate need for that patient, then it becomes our immediate goal. And I think that level of commitment as a team makes us stand apart from other cancer centers.